At a press conference in Bangalore, Metropolis Healthcare Limited launches BRCA1, BRCA2 genetic testing for hereditary breast and ovarian cancer, molecular oncology pipeline for lung and common cancers.
That is why I think our country we diagnose cancer at a much later stage 3, stage 4, whereas in USA, for example, as a comparison, 70 to 80% of breast cancers are in stage 1 and stage 2, and in India 70 to 80% patients are in stage 3 and stage 4. So that is a difference, and people should learn to go to the doctor when they have no problem at all, rather than go to the oncologist when they have a big lump, because at that time already is advanced to stage 3 or stage 4, and cure rates are very less, 30% or 40%, whereas in stage 1 and stage 2 you may cure 70 to 80% of the patients. That is a problem.
Chief Scientific Officer of Metropolis Healthcare Limited. Metropolis is a 40-year-old diagnostic company, and today I'm very proud to say we have launched Molecular Genomics. We have created an innovation cell to provide molecular testing to the Indian patients, whether they are cancer patients, infectious disease patients, or just pregnant ladies. We want to reduce the cost of testing, we want to make it more accessible, more available, and we want to help as many patients as we can. So for example, if a pregnant lady had to get tested, every pregnant lady has to undergo maternal screening to see if the child is not a special child. The child should be a normal child. But earlier the tests that used to happen, there was 5% false positivity. Now you imagine all these women after infertility cycles or even normal, they get pregnant, and then if they have to do medical termination of pregnancy, it becomes very dangerous. Especially, even if they have to go for invasive testing, that also has side effects. So what NIPT or non-invasive prenatal screening does is that at 99.9 sensitivity and specificity, at zero risk to the mother or to the child, you are able to, from the mother's blood, you can take the baby cells and you can do chromosomal analysis through these very, very, intense machines and through bioinformatics and algorithms, and you can tell whether the baby is going to be normal or, has some chromosomal abnormality. And if there isn't a chromosomal abnormality, then the child can be medically terminated after confirming it with the invasive test.
I am from Metropolis. I want to discuss about the launch today. We had a launch called Medical Genomics. Medical genomics means it is the study of some of the genes which are important in making diagnosis of a cancer or any disease. It also helps in making prevention of some of the diseases. It also helps in treatment of some of the diseases. It's a very simple blood test. We take sample of blood and give the report within 10 days. So within 10 days, patient will come to know, that is pregnant woman, whether the patient has an abnormal baby called trisomy in her womb or not. So depending upon this, the doctors, that is the gynecologist, will take a call whether this has to be aborted or not, depending upon the report. It may be positive, it may be negative. Either we take it as not positive, negative, sometimes we call it as low risk or high risk. Okay, this is about the prevention of this trisomy or the other abnormalities in a woman carrying a baby. That is number one. Number two, we also now introducing what is called BRCA1 and BRCA2. It is a breast cancer gene. This breast cancer gene runs in some of the families. Suppose a patient gets a cancer breast, we would like to look at whether this patient is carrying this particular gene or not. Suppose it is found to be positive in the woman who is having a breast cancer, then we are going to detect this in the family members. Or the family members could be their sisters, their their mothers, or there could be their other related blood related people. For all these people, when you do the test, suppose it comes positive, we have to screen them as early as possible to see whether you can able to prevent or make an early diagnosis. Because in the general population, it is around 13% what we get as the cancer detection. But in those who are having BRCA1 and BRCA2 are one of these positive, in them the chances of getting the cancer, that is breast cancer, is very, very high. It is about up to 40 to 80%. This is the importance of prevention of the breast disease by doing this genetic test called BRCA1 and BRCA2. The third one is we are talking about EGFR mutation. This is for those who are having lung cancer. 15% of the people who have lung cancer, they have this BRCA1, the EGFR mutation positive. When you have EGFR mutation positive, we can introduce some of the tablets which contain the receptor antibodies. When you use these kinds of tablets for these patients, the whole lung, whatever the cancer is there available, will go, it actually melts actually, okay, it will just disappear from the patient. This is what it is. It is also helped in making not only diagnosis, in also making us to help in treating these patients. This is the importance of this, medical or molecular genomics, what you are talking about, and what you launched from the Metropolis Healthcare Limited, India.